Good afternoon, ladies. A very warm welcome to all of you gathered here today. Thank you all for making it today despite all the odds you had to choose to come here on time. I would like to introduce you to the proceedings of the event today. Firstly, I would like to introduce you to our sponsors and organizers, Magniflex. Magniflex's history began in 1960 and has successfully completed 60 years of creating magnificent products with excellent quality, craftsmanship and modern technology, which are loved by 50 million customers worldwide. Unlike other brands, it has an exclusive range of products that are patented, and one of them is Magnistretch, which we have displayed here today. To have the best quality control, Magniflex has a single production plant in Tuscany that produces 10,000 mattresses a day and distributes them to over 100 countries. This global brand is 12 years old in India, that is recognized and loved by customers of India. Mr. Anand is the owner of this wonderful brand, Magniflex India. Mrs. Sonia Nichani is the director and also a Flo Bangalore member. Anand is also the managing director of Polyflex India Private Limited, a holiday company with interests in diversified segments like luxury mattresses, FMCG, warehousing, startups, and also the auto sector. I would also like to welcome our chief speaker today, Dr. Muthu.
Hello.
He is a renowned physiotherapist who will be guiding us today on the importance of back and spine health. I will now hand over to Mrs. Sonia Nichani to give us a brief. All the vital aspects regarding today's topics will be conveyed to you by her. Kindly welcome Mrs. Sonia Nichani, our Flo member, to go ahead with the proceedings. Thank you.
It is a great pleasure to welcome Mr. Muthu Kumar on behalf of one and all present here. Mr. Muthu Kumar is a sports and musculoskeletal physiotherapist and a member of Indian Association of Physiotherapists. An internationally trained spine specialist who is an expert in diagnosis, sports rehab, post-surgery care and spine mobilization. He is the founder and the lead physiotherapist at Stride. He is also renowned as the principal in charge of physiotherapy for India's U19 cricket teams and accompanied the teams during the 2006 and 2008 Cricket World Cups. He was also the team physio for Royal Challengers Bangalore for 4 IPL seasons. We now request Mr. Muthu Kumar to enlighten the audience on how to look after our back and spine and the health issues revolved around it based on his precious knowledge and experience in this field.
Good evening, ladies. Pleasure meeting you all. I'm sure some of you know me, most of you don't know me. Okay, so though they have said spine care, but I have come with a preparation for general care of people around this age group. You know, I was told by some that it will be an age group of around 40 or 40 plus. So I have come with a kind of preparation of how generally we as middle-aged people go about our own health and general, the futuristic problems of this age group, any kind of pains and aches, how we can deal with it without, getting too tensed about it. Okay, so I'm going to cover a few topics, and on top of that, if you want to, ask anything or if you want me to cover anything, we can talk later. And I think followed by this, we also have a Q&A session for about 2 minutes. And during that time, one of the other you can ask me what you want. Okay? Thank you. So, I think she has covered everything overall. So, I have worked in sports for about 14 years before I started my own practice in Cunningham Road. And I'm mainly a musculoskeletal, means a person who deals with muscles and joints. So I'm mainly a musculoskeletal physiotherapist who takes care of all your joint aches and muscle aches and any kind of joint related pains. And I have traveled with a few cricket teams, like Karnataka state team, and as well as in which is a U19 under 19 cricket teams when 2006 and 2008 World Cups, and also I worked with the RCB for 4 seasons, and also I worked with a few badminton leagues and Champions Tennis League and stuff. Okay, the last one is where I function from, that's my clinic, and where we specialize on treating people with spine and sports related injuries as well as rehab them post any kind of surgeries. Lovely. So why are we here? To understand the most common ailments of this particular age group, as I spoke about, and how to deal with them. Okay, which is the best way without getting into surgeries or without getting into any aggressive, management strategies. How to deal with them, and what are the preventive strategies? How you can from here prevent yourself from, suffering from any of that in the future, and also importance of being active. Alright, so this is one of the most commonest thing that I see in women of this age group. Neck pain is the most common pain, and this can be age related, this can be work related, this can be lifestyle related. When I say age related, as soon as the patient comes, when I see them and say probably it's age related, they get very angry. Alright, they don't like to be mentioned about the age. But honestly, let's face the fact, right? I mean, we are in this age and we are not any fresh, any young, where everything is mobile and moving very, very properly, right? So we have abused them, we have used them, we have kind of, not really bothered to take care of them as much as we should be. So obviously those abuses cause some amount of aches and pains. So that's the reason why I've said age related. When I say work related, work can be a desk job. Long days in front of the desk in an improper way can lead to stresses and strains on the neck over a period of time, which can cause neck pain as well. And when I say lifestyle related, that's our problem right now. We are all stuck here, right? So the mobile phone usage or any kind of reading, any kind of not sure how many I can relate to cooking, but I don't want to put anyone in that position, but even cooking in a kind of very low kitchen cabinet can also make you bend for a longer time, which can also lead to a lot of strain to the neck. So as soon as they come into the clinic with a neck pain, some of them will kind of show me the MRI, some of them will show me the X-ray, some of them will show some of the medical reports, some of them will not have anything. Generally, I first like to deal with the person as person. I check them first hand to see what is going on in the neck, and then whatever I find, I try to correlate that with the X-rays or MRIs. Okay, most of the times X-ray and MRIs can be misleading. Okay, in this stage, when you see an X-ray or MRI of yours, it is microscopic, it is too much in detail, too much into the joint areas in a very focused way. So as you see, as we grow older, we will have some amount of degenerative changes, some amount of wear and tears, right? So all that will be shown up. So if I want to fearmonger, if I want to cause more fear in you, I can say you have this, you have that, you have that. But if you see 100 MRIs or scans of any of us in the age group, 98 will not have proper ones. Okay, we all will have some kind of findings. Some may be pretty bad, some may not be very bad, right? So generally it shows up like a slip disc or disc bulge, right? So which is very, very common. Even in a normal person with no pain, when you take an MRI, there will be minimum of 2 or 3 or even 5, 6 slip discs, right? And because someone said it's a slip disc, and we are known to be kind of getting scared and getting anxious about hearing the term slip disc, right? So then we start worrying about it, we start reading about it in the Google. And that's the worst place to go to, right? So you start reading about it, and then everything leads to the most severest of the findings in Google, right? So you start thinking about, do I have this, do I have this, do I have this? At the end of the day, even if you don't have it, you start feeling it. right? So do you really have to do all this is what my question is. I generally would try to cool them down saying, you know what, it's not anything serious. Okay, and most of the times it is not serious. Some of them are serious. In that case, I would say you may have to go for a further investigation or further medical advice. In most of the cases, slip disc or bulging disc or any kind of inflammations can be dealt with in a very conservative manner, and you do get over it over a few weeks or over a month or two. But the thing is, most of us want an immediate relief. Okay? If I see you today, you should be better tomorrow, you should be better the after. And I'm sorry to say that mostly women are the ones who get really, restless, I would say. They want things to be happening quickly. And unfortunately, our body is made up of tissues and bones, right? So they don't respond as well as we want it to respond. And they slowly respond. They definitely get better, but we don't really allow them the time. Okay? It's not a painkiller where you take painkiller tomorrow, you feel better, but if you don't continue with the day after, you're again in pain. Why is the pain again? Right? That's what we start thinking. So painkiller is not the healing. Painkiller is a short-term measure. It's feeling cold. Thank you. So painkiller is not the way to go unless you are in a very severe pain. The pain of, in a scale of 10, if you have, say, if it's more than 6 to 7 out of 10, then that's when you have to venture into any kind of painkiller or any kind of aggressive measures. Otherwise, you may have to rest for a few days and things will start getting better. Okay? So that's why I've said that can be cured temporarily. Okay? It's not permanently. The permanent care is only by how you follow. If you are told to do certain exercises, you have to make sure you exercise regularly to prevent the underlying damage or underlying cause to show up again. But the thing is, the underlying cause or underlying, can I move the table somewhere? It's hitting it there.
Can you list too much?
It's kind of hitting on it. Okay, so the underlying cause can be a degenerative bone, degenerative disc, or degenerative ligaments, which cannot be completely cured. As we are not going into it and to cure it. But the thing is, by strengthening the structures around that area, you are actually minimizing the load on that area which is inflamed or which is degenerated. And the more and more you keep them stronger, the less and less that area gets loaded. So less and less you get flared up or you get the pain. So that's a basic of physiotherapy. Okay, what we do in physiotherapy is try and minimize the area that's affected being loaded, and try and strengthen the structures around that area so that that area becomes more stronger to deal with all the stresses and strains of the daily activities, and also to cause less pain for you. Alright, so that's what we do. And here I mentioned about sitting posture. I will come to that. Activities through the day. So when I say sitting posture, a lot of us sit the way we are so used to sitting. Some of us are like slouchy, some of us are straighter, some of us don't take the back support, some of us like to sit in a very question mark way, right? So there is no ideal posture in any way. Okay, at the end of the day, the most comfortable posture for you is the ideal posture for you. So you got to set up in a way that you are comfortable with. At the same time, if you have an issue, you need to see what are the posture that you can, kind of position yourself to minimize the affected area being aggravated. Okay, so ideally, I would say wherever you sit right back into the seat and take the back support and try and sit upright as much as you can. But how long can you do that is questionable, right? If you are sitting for more than an hour, you obviously automatically start tiring up and kind of slouch and sit. Slouching and sitting doesn't cause any amount of damage as long as it's not for more than half an hour. If you get up and move around and come back and sit, it's fine. But it doesn't mean you should slouch and sit, but you can sit upright is better. But longer you sit, every half an hour you get up and move around and try and sit and be active, every now and then. Okay, activities through the day. how that causes neck pain is, as I said, the typing posture, reading posture, or any kind of activity that you are in, making sure the neck is not falling below here, instead here, right? The neck has, the head is about 1/5 of our body weight, if you are aware. And 1/5 of our body weight standing on top of the small cervical spine can really cause a lot of stress and strain around that cervical area, which can over a period of time start degenerating, start getting more painful. So the more upright or more, the eye level everything is better than looking down and causing more strain there. And strengthen the shoulders and upper back. How does that matter? Is that's what holds your head upright, right? The stronger your shoulders, the stronger your upper back are, the lesser the load on the cervical spine. The more weaker you are, you start slouching, the more you round up, right? The more you round, more there is a shearing force on the lower neck or lower cervical spine, which causes a lot of tension to the nerves arising from the neck, causing more of tingles and hand pains and pain in the chest and pain in the upper back. Okay, so if you can strengthen your upper back and shoulder, that can also help you to prevent a lot of damages to the neck. So how do we treat it? How many of you have neck pain here? Wow. Okay. No, I'm sure it's about 90-95% of us will get at some point, but it's very, very common, right? So how many of us really, not worry about it much? Don't worry about it. Very nice. Okay, so I had a patient today morning. She just delivered a baby in about 6 months' time, and she's feeding a lot. And she had a very, very severe pain in the arm. Her thing was only in the arm, right? So she went to the doctor and they did an MRI, and they said it's cervical spondylitis, and she's only 38. And she was like, why am I getting spondylitis? What do I say? So I said, let me check you and then see what it is. And then at the end of the day, it's actually the pain was coming more from the upper back than the neck. Okay, but the assessment was done on the neck, and as I said, all of us will have some kind of degenerative changes or some kind of age-related changes in the neck, and she was found to be having some, and it was related to that. But though that was not causing the pain. Okay, so why I'm saying that is, ideally, it's more about diagnosis that deals with the pain that you have, and that helps you to prevent you from suffering and worrying, and it also helps you to recover faster. Lovely. So these are the few postures that I am mentioning, and so that lady you can see, and the way she is sitting on the mobile phone, and I have seen many of us doing that, and that guy is sitting on the laptop. I don't know, he's kind of getting into it. And the other one is the sleep posture, right? How actually a lot of ladies come out with neck pain because of sleep, and they wake up with neck pain. Okay, so that's where these guys can help, I think, in terms of a very comfortable mattress and comfortable pillow. Both of them play equal role. So one pillow doesn't suit all. Okay, some of us like pillows, some of us don't like pillows, and the pillows can be firmer, can be softer, can be higher, can be lower. It depends on each and every individual. Whatever you are comfortable with, wherever you sleep and get up with no pain and discomfort the next day, you are in a good pillow. Okay, so there is no ideal pillow for anybody, so don't get stuck with anything that I need to buy this pillow, I need to buy that pillow. Try a few, and then whichever gives you the maximum sleep comfort, please go for it. As well as mattress. Mattress definitely should be reasonably firmer, should not be saggy, and should be kind of supportive to your body. Okay, some of us don't change the mattress for too long, and that becomes, taking our body weight over a long period. The mattress becomes, kind of sunk in, and that actually leads to neck pain as well as back pain. Back pain more than the neck pain, but it doesn't give the right posture for us. So make sure you guys take care of the mattress there. Okay, so spondylitis and arthritis. These are the terms we'll all deal with from here. Okay, it's a very, very commonest finding of every medical checkup that you go for, and I have put this topic just to make sure you guys are kind of aware of it, and you are not going to kind of get anxious about it. Okay, when you read about it in your medical report or your X-ray report, just accept that is part of life. Okay, we all will have it, and minimum amount of changes in the bone, minimum amount of degenerative changes in the bone is expected. The minimal it is, the less pain it will cause. The maximum it is going to cause more pain. But all of them, most of them will be, can be dealt in a conservative measure, conservative management style. And only in a very severe case of arthritis in the knee, you may have to replace the knee. Otherwise, most of the other things can be, helped with conservative exercises and kind of lifestyle changes and stuff. Okay, and how often do we need the X-rays and MRIs? Okay, I think it depends on the person you go to in terms of doctor, but most of the times if the pain is severe, it's always good to have an X-ray or MRI done and understand what is going on inside. But at the same time, keep it as a finding. Don't get overly into it and understand. Try to understand through Google and stuff and start worrying yourself about all the other terms that comes in. Okay, the fear mongering I mentioned because the reading through all the articles that you read, most of them will only give us negative feedback or negative input. Everything causes more and more kind of worry in your head, and you start losing sleep over it. And that leads to further and further aggravation of symptoms, further and further aggravation of pain, which will not allow you to even get better, even if you are getting better, because the worry causes more sensitivity to the pain, and you start feeling more and more restless and sleepless. Lovely. Nutrition and hormone changes. Okay, as you are aware, after 40, you guys are all going to go for, at some point, menopause, and menopause causes crazy amount of changes in you. Okay, some of you are lucky not to go through any kind of, heat flashes and, bloatings and a lot of body aches and stuff. Some of them have nothing and they go through it comfortably. And I think, I'm not sure how far that can help, but the exercises and dietary practices over the past decade, like say at least from 30, the age-related changes in women start about 23, 24. For men, it starts at 30. Okay, so it's not you have to wait till 45 to feel aged. It all starts from there. So what we do in 20s and 30s keep us in good health in the 40s and 50s and 60s. So it's very important that we take care of ourselves in the earlier days to make sure we are exercising, we are not putting on extra weight, we are not allowing the body to kind of degenerate quickly by doing enough amount of exercises, yogas, gym, whatever you can do it as long as you are active. Okay, and every decade from here, from 30, we lose about 7 to 8% of our muscle mass. The muscles in our body is like a concrete in a pillar. Okay, the stronger muscle that you have, the lesser the load on the steel in the concrete, the pillar. Okay, the steel in the pillar is in us is the bone, right?